Hello, welcome. I'm Dr. Darren, family medicine physician, and today we're doing health education on topics that you want most. This video is on my top 5 causes of chest pain. There are common medical problems that can cause chest pain, but chest pain can also indicate a serious problem that may require the hospital and could kill you. So this is a really important topic that you need to know about. We're going to be covering the symptoms, treatment, and prevention of these 5 important causes of chest pain. Now, if you like content like this, be sure to subscribe and leave a comment down below, letting me know what health topics you'd like covered in future videos. In addition, if you have any questions, leave them in the comments and I will answer all of them. Now, before we get started with chest pain, remember that these videos are for education purposes only. I cannot give personalized medical advice here. So if you're having symptoms such as chest pain, make sure that you go to see your doctor right away. Now, let's get started with my top 5 causes of chest pain. Number 5, pulmonary embolism. There are other lung diseases that can cause chest pain, such as pneumonia and pneumothorax, but today we will focus on pulmonary embolism. A pulmonary embolism is a clot that forms in one of the arteries in the lungs, and this can damage the lung tissue and interfere with the lung's ability to supply oxygen to the rest of the body. The most common symptoms of a pulmonary embolism include chest pain, trouble breathing, a fast heart rate, and sweating. An embolism is a clot that comes from a different part of the body, and in the case of a pulmonary embolism, the clot typically comes from the lower body, from a DVT, a deep venous thrombosis, which is a clot in the leg or in the pelvis. Because of that, it's common that leading up to a pulmonary embolism, you may be having symptoms in your lower body, such as swelling of one leg, pain of one leg, and numbness or tingling in one leg, or some combination of those. A pulmonary embolism is an emergency, so it's important to get to the hospital as soon as possible when a pulmonary embolism is suspected. The standard treatment is to start blood thinners, which will stabilize the clot and prevent it from getting bigger, and will eventually help to dissolve the clot. Supplemental oxygen may be given. Medicines to support the heart and the lungs may be started. In severe cases, we may use medicines called thrombolytics to break down the clot fast. And in the most severe cases, we may do surgery to go into the artery and remove the clot. Preventing a pulmonary embolism comes down to lifestyle changes and recognizing symptoms. A pulmonary embolism forms from immobility, so it's important to live an active lifestyle, exercise regularly, and avoid prolonged immobility. So if you're on a road trip or if you're on an airplane, make sure that every once in a while you get up and walk around to help to prevent clots. Obesity is a risk factor for clots, so make sure that you maintain a healthy weight. And in addition, tobacco products can cause a pulmonary embolism because they damage the arteries, so avoid all tobacco products. The most common cause of a pulmonary embolism is a DVT, a deep venous thrombosis, so it's important to recognize those symptoms. If you ever have symptoms in one leg, such as pain or swelling or numbness or tingling, make sure that you see your doctor right away, because if you do have a DVT, it will be important to start blood thinners in order to prevent a pulmonary embolism. Number 4, heart attack. There are other heart diseases which can cause chest pain, such as atrial fibrillation or pericarditis, but today we will focus on heart attack. A heart attack, otherwise known as a myocardial infarction, is a blood clot that forms in one of the coronary arteries, and this can cause heart tissue damage and could even kill part of the heart tissue. These clots are most commonly caused by atherosclerosis, the gradual buildup of plaque and cholesterol in our arteries as we get older. The classic symptoms of a heart attack include crushing chest pain, trouble breathing, especially when you're exerting yourself, sweating, and there may be pain or numbness or tingling in your left jaw, your left shoulder, or your left arm. There are atypical symptoms also, and these are often experienced by women or elderly patients, and these include back pain or abdominal pain or feeling dizzy. A heart attack is an emergency, so it's crucial that you get to the hospital as soon as possible if a heart attack is suspected. The most important treatment for a heart attack is to treat the clot, and this can be done by doing a cardiac catheterization, in which we enter the coronary arteries to treat the clot. And in severe cases, we do a more complicated surgery called a coronary artery bypass graft, or a CABG surgery. Other treatments include using medicines to treat the clot and to prevent future clots, and these include aspirin, statins, beta blockers, and ACE inhibitors. Additional treatments include lifestyle modification, so eating healthy, lots of fruits and vegetables, exercising regularly, and maintaining a healthy weight. These are all great ways to help to prevent having another heart attack in the future. Number 3, anxiety. There are many types of anxiety, including generalized anxiety disorder, post-traumatic stress disorder, and panic attacks, and these are all common causes of chest pain. I believe that mental health is the most important aspect of health, and unfortunately, anxiety is common and it sucks. Anxiety is when somebody experiences stress that is frequent and severe, and it's causing a negative impact on that person's life. The common physical symptoms of anxiety include pain in your chest, trouble breathing, palpitations where your heart's beating really fast, feeling sweaty, feeling shaky, and feeling dizzy. There also may be upper abdominal pain. The best strategies for treating and preventing anxiety include therapy, medicine, or both. Therapy is never the wrong answer for anxiety. With therapy, you can best understand your symptoms and how to prevent them and how to deal with them best if they occur. When it comes to medicines, we have different kinds of medicines to help to treat anxiety and to prevent anxiety. And these include the SSRIs, the SNRIs, Wellbutrin, buspirone, and in severe cases, sedative medicines like Ativan or Xanax. So if you're suffering from anxiety, make sure that you talk to your doctor right away so that you can get started with therapy or medicine or both. Number 2, acid reflux. There are other GI problems which can cause chest pain, including esophageal spasm, but today we'll focus on acid reflux. Acid reflux is also known as gastroesophageal reflux disease, or GERD. And this is a problem with the stomach. There's too much acid in the stomach, and the valve that connects the esophagus to the stomach is more open than it normally should be, and this results in the acid moving up the GI tract, up the esophagus and to the throat, and this can cause a spectrum of symptoms. People with acid reflux can get pain in their upper abdomen, they can get chest pain, they can get coughing, they can get throat irritation, clearing their throat a lot, like that. They can get nausea. The symptoms tend to get worse after eating a big meal, particularly a very spicy meal, or where there's alcohol or caffeine or NSAIDs. And in addition, the symptoms tend to be worse after lying down. The treatments for acid reflux include lifestyle changes and medicines. For lifestyle changes, you want to decrease the amount of foods that you eat that increase the acid in the stomach. That means that you want to cut back on alcohol, caffeine, carbonated beverages, spicy foods, and you want to avoid NSAIDs, medicines like ibuprofen or naproxen, because those also raise the acid in the stomach. Smaller meals that are more frequent tend to be better for acid reflux compared to having larger meals. And in addition, you want to avoid laying down right after eating. So a good rule of thumb is to avoid lying down within 2 or 3 hours after eating, and in particular when you're going to bed. So whatever your bedtime is, have a rule of no eating or drinking within 2 hours of when you go to bed. And this will help to keep your acid reflux symptoms under control. We have medicines that can be really effective for acid reflux, and these include antacids like Tums and antihistamines such as famotidine. But the most effective medicines for acid reflux are the PPIs, the proton pump inhibitors, and these include medicines like omeprazole and pantoprazole. These PPIs are the best medicines, so I recommend going straight to these if you need to take medicine for acid reflux. And finally, my number one cause of chest pain, chest muscle pain. Other kinds of musculoskeletal chest pain include rib injuries and costochondritis, but today we'll focus on chest muscle pain. This kind of chest pain can occur because of overexertion, such as exercising too hard, or due to inactivity, such as lying on the couch for a long time, or being hunched over a computer for a long time. This type of chest pain tends to be brief, only lasting an instant or maybe a few seconds or a few minutes. And that area of the chest where you're feeling the pain, it might be tender. So when you press on it, you might feel pain. The treatment mainly is lifestyle changes. Make sure that you don't overdo it when you're exercising or if you're performing a job that's physical. And if you're lying on the couch for a long time, or if you're hunched over a computer, make sure that you take breaks every once in a while. Get up and walk around. Get your muscles moving. That'll help to prevent and help to resolve this type of chest pain. Medicine typically isn't needed for this, but you can always take some Tylenol or ibuprofen, and that'll help to take the edge off and resolve this type of chest pain. That's it for today. Those were my top 5 causes of chest pain. Thank you for watching. Be sure to subscribe and leave a comment down below letting me know what health topics you'd like covered in future videos and if you have any questions. Remember, these videos are for education purposes only, so if you're having chest pain, make sure that you go to see your doctor. Bye-bye.